Hello, this is Michelle from Physioactive Indonesia, bringing to you our Singapore Surgeon Insight series. Today, joining us is Dr. Benjamin Toh, orthopedic surgeon from Orthopedic and Spine Clinic, Singapore. How are you, doctor?
Hello, how are you? Thank you for asking me to give the interview.
Thank you for taking the time to do this with us. Doctor, can you tell us a bit about your qualifications and specialties, please?
I am an orthopedic surgeon practicing in Singapore. I graduated in the Singapore National University and I've been practicing in spinal and orthopedic surgery since 2005, since I was in Singapore General Hospital. And I also spent a year in fellowship in UCLA in California. And my specialty interest in orthopedics is spinal surgery, more specifically in minimally invasive spinal surgery.
Okay, so let's talk about minimally invasive spinal surgery then.
Minimally invasive spinal surgery is a descriptive term for surgery where the access to the spine or access to that part of the body is less invasive than the usual open surgery. This entails us to do surgeries through a very small incision, and this small incision allows us to achieve a few things. The most important thing is that because there is more preservation of normal tissues, there's less destruction of tissues to get the access to get the job done. The advantage to the patient is less pain, less blood loss, faster recovery, shorter hospital stay, and lesser complications of wound and lesser complications of pain and the need for pain medications.
So would you say that this minimally invasive spine surgery is a target for a certain demographics? Is it better for older aged patients to have this kind of surgery?
Minimally invasive surgery for the spine can be done for patients of all spectrums because the human anatomy is the same. And it can be done for about 70% of spinal conditions, and spinal conditions that require surgery, uh, with certain exceptions, would benefit from minimally invasive surgery because this operation can allow patients to get back to their normal life quickly.
Okay, so what kind of conditions warrant for this surgery? If we have to discuss the spine conditions.
So, in my practice, I do minimally invasive spinal surgery for patients who have problems in the disc, in the bones, for instability, for pain, um, and anything that causes spinal problems. So the patients come with problems of pain in the neck, pain in the back, numbness in the hands, numbness in the feet. And then we have to make a proper assessment and analysis of what they have. And based on what they have, then we can offer them surgery. The most common reason for doing surgery or minimally invasive surgery for the spine would be for disc herniations, which is also known as a slip disc. Okay, so slip disc conditions which can happen in the neck and the back, we can do surgeries to help them to feel better. Now, the disc is really the cushion that sits between two bones. Now, the disc is also next to the nerves that come out, and these nerves are the nerves that give sensation to the arms and legs. Now, what happens in a slip disc is that the cushion, which normally is a fibrous ring with a core of jelly, has a tear in the outer lining of the fibrous ring, and the internal jelly can extrude out and it can pinch onto the nerve. When it pinches onto the nerve, then the nerve gets compressed and the patient feels extreme pain in the arm or the leg and numbness in the hands and the feet. Now, first of all, I guess to get a better understanding, then most patients who have spinal conditions do not need surgery. Most patients would benefit from physiotherapy, from rest, a change in their lifestyle, and only a small proportion of patients whom these conservative treatments don't work, then surgery might be needed to make them better. However, there are certain cases where when we see the patient and the condition is bad enough, we would offer them surgery immediately. Now, typically when a patient comes to see me, they will come with a certain condition, okay? And when we assess patients, we start off with interviewing the patient to see what they have, okay? To check where the symptoms are. But we don't just treat the patient as a condition of the neck or the back or the condition, but we want to see the patient as a whole. Then we would like to ask the patient what their background is, what their lifestyle is, whether they are a very active person or they are very sedentary, what is the expectation, what sports do they play, what is their day-to-day activities, the occupation like. And then we also want to know what are all their comorbidities, whether they have any medical problems, whether they have any sickness or any allergies or any conditions that they've got before, which will make their condition different from a regular person. Now, after interviewing the patient and knowing exactly what they have and knowing their background and their expectation, then we would usually examine the patient to elicit certain signs and conditions that they have, and we would order some tests to confirm the diagnosis. This may include x-rays, it may include MRIs, bone density tests, CT scans, or even nerve conduction studies. And after coming to a diagnosis, then we would offer them treatment. My philosophy in treating patients is really to start with something simple, and my aim is to get away and make them better with the least amount of treatment possible. Like, for example, if they can get better conservatively with medicines, physios, or rest, or change in lifestyle, that's the best. But then if some of them, they don't work that way, then maybe spinal injections. And if some of them don't respond well to injections, then minimally invasive treatments to help them to feel better.
Okay, so for our patients who plan to come from Jakarta or from Indonesia, how should they plan their travels? Does assessment and the imagings take a day or two? And then how long for the recovery from the surgery? Can you give us a better picture of this?
Okay, so typically when the patient comes for assessment, the first thing we do is to assess them. It would help if they already came with x-rays or MRIs of their condition, then that might be useful because that may save some time. Although sometimes we will still order MRIs of our own if we felt the imaging is not clear enough. A patient that comes from Indonesia or any other country that comes in, they typically would need 2 days. The first day is for me to see them and look at the scans and maybe do some tests after I've seen them, and then see them again the next day after the tests are ordered. So typically they come with a condition, and I order an MRI scan or an X-ray, and then the next day when I review the scans and I can tell them what's happening. Now, for some patients, if they've already got the scans done and we already know what's going on, then when they see me, we already know what they need to do. Now, if there are candidates for surgery, then I would advise them what is the proper procedure or what is the surgery that's needed. Now, once we've decided, then we would usually give them a date for the surgery, which is unlikely to be on the same day because operations need to be planned and operating room schedules need to be done. And we'll give them a date to come back for treatment. Now, once we've decided they need to go for a procedure, we would also want to proceed to make sure they are fit for surgery. And fitness for surgery usually entails getting a checkup of their heart, because a lot of these procedures are done under anesthesia or general anesthesia. We will also want to check their blood tests to make sure that the blood is okay, they don't have any abnormalities in the electrolytes, so that we know that they're fit for surgery. Now, if the patient has medical conditions, especially like if they are on blood thinners or they have any other medical conditions, we want to optimize these conditions before they go for surgery. Typically, like elderly, a lot of people have heart conditions and they are on blood thinners, and we need them to stop the blood thinners before we can do the surgery. So they may have to stop their blood thinning medicines about a week before the operation so that when we do the surgery, they do not have excessive bleeding. So sometimes when they see me on the day and we say you need surgery, we will also send them to be assessed by another specialist like a cardiologist or a kidney doctor or a lung specialist to make sure that they are fit for surgery. Now, if we have optimized them and they're fit for surgery, then we will plan for them to come for surgery on a specific day. Now, minimally invasive surgery, depending on how big the surgery is, oftentimes maybe just a single day stay or a day surgery or maybe 2 night stay. Okay, so we can do a very wide variety of conditions from spinal injections or to radiofrequency procedures to stabilize the disc to minimally invasive surgeries to take the disc fragment out from a pinched nerve to minimally invasive spinal fixation to fix the spine with implants and stabilize the bone. And also, we can also do minimally invasive surgeries like cement injections to stabilize the bone so that the bone does not fracture or collapse further. So there is a very wide range of things we can do to, to treat the patients, ranging from injections to removal of disc material to stabilization of the spine with implants.
Okay, and after the surgery, do they need to come back and see you before they can travel back? How many days do they need to be in Singapore before they can fly back?
So typically for a patient who went for a minimally invasive surgery, like a keyhole surgery for a disc prolapse or disc herniation, like a slip disc, when they discharge on the same day or the day after procedure, I would usually see them within about 5 days after discharge. I want to rest, and when I see them within 5 to 7 days after the op, I want to make sure their wound is nice and clean and not bleeding. So within a week after the surgery, if the wound is nice and clean, not bleeding, then they're fit to take a plane and go back home. But for a lot of patients, the surgery is just part of the entire treatment process. They need to be very careful about their posture. They need to avoid excessive bending, lifting. They need to go for physical therapy to strengthen their core, to watch and learn how to improve their balance, improve their strength and their flexibility without injuring or having the condition to recur.
This is very interesting information, doctor. Do you have anything else to share to patients if they decide to see you?
I think for patients who want to see us, actually they shouldn't worry about anything. They don't need to do that test or anything in Indonesia. Just come. If they expect that they would help, it would be helpful if they emailed us beforehand to tell us what is their condition they are seeing us for, and if we feel that they are likely to require scans, they would benefit from seeing us in the earlier part of the day. For example, if they see me in the morning and they've told us they are coming for certain conditions, we can pre-book an MRI scan or an investigation so that when they see me in the morning, we can send them for a scan by the afternoon and then see them by the next day morning. So if they come and see me at the end of the day, then they may lose a day because the scan will be the next day, and then maybe we can see them the day after. So, but a lot of it is useful if they give us some information or some background of that condition before they see us on email.
Okay. Doctor, do you do teleconsultations as well as initial?
Yes, we do teleconsults as well. So if they email us beforehand, we can actually do a teleconsult to know roughly what's going on so that by the time they see us, their time in Singapore would be very much more efficient and more streamlined because we know what we need to do and we can order the stuff that we need even before they see us. So the teleconsult may be the first consult, and then they come into Singapore, have all the investigations done, and then they see me with that. And then their time in Singapore will be shorter.
Thank you, doctor.
Thank you.
For our viewers, if you're interested in speaking with Dr. To, you can find details of his WhatsApp, clinic phone number, and website in the description below. If you're planning to get your surgery in Singapore and live in Jakarta, you can start your physiotherapy in Physioactive Singapore and continue your rehabilitation program in Physioactive Indonesia. Please find details of our clinic below. On behalf of our entire team of Physioactive Indonesia, we want to thank you for tuning in, and we look forward to bringing you more top quality content from leading industry surgeons.